Hello and welcome to the Bleeding Control course. First things first, I have nothing to disclose, no financial conflicts of interest because I have no finances. Why learn this? You're seniors in medical school, you're signing up for a bleeding control course online. We're just going to talk about Band-Aids and that sort of thing? No. We're going to talk about bleeding control at the level of the physician provider. This is unlike most things out there that either require you take a lot of other coursework with it, for example, your advanced trauma life support, or they are directed at the layperson. Bleedingcontrol.org and their program Stop the Bleed is directed at the lay level. I think we can do a little better than that. What's more is unintentional injury is the leading cause of death for Americans from age 1 to age 44. That's per National Institutes of Health and the CDC. That's a pretty significant threat to life to not have the knowledge and practice to manage those situations if and when they come up. How about this? If that doesn't sway you, I think that almost everyone watching is going to have some difficulty answering at least one of these questions quickly and correctly. How do you apply a tourniquet? How do you make a tourniquet? When do you stop tightening that tourniquet? When the bleeding stops or when there's no distal pulse? Is it important which? Where do hemostatic agents factor into your bleeding control plan? You don't want them to get in the way of the tourniquet, but if you can use them to stop the bleed and you don't need a tourniquet, isn't that good too? Packing wounds. When do you pack? What kind of wounds can you pack? Which wounds shouldn't you pack? How do you control a bleeding dialysis fistula? That's a bit of a scary one. How do you tell if it's life-threatening? Ooh. Apply direct pressure. No, okay, obviously, what if direct pressure doesn't work? Continue applying direct pressure. Okay, that's not what I'm getting at. Are you a first year? I thought this was supposed to be upperclassmen only. How did you get here? That's super disconcerting. Okay, anyhow, can we give any drugs for bleeding? You're a fourth year, why don't you tell me? What's up? No comprende, Chief. Listening to your dumb video on 5x speed. And we're done. Shower beer. All right. Not a lot of audience participation. We need better answers to these questions, especially if we may be the ones at bedside dealing with a life-threatening hemorrhage. So, we're going to follow some guidelines. Guidelines are going to keep us safe, especially if you're the one who has to control the bleed and you know that you are acting in accordance with the consensus of medical professionals. So we will follow the Advanced Trauma Life Support course and their guidelines from the 10th edition that they put out in 2018. We are going to follow the Tactical Combat Casualty Care guidelines put out in 2019. We are also going to keep in step with the American College of Surgeons and their Committee on Trauma and the Hartford Statement that has all gone to influence the course material of Stop the Bleed. And we're going to take a little bit of advice from the U.S. Army Institute of Surgical Research, deciding what tourniquet to use, deciding what hemostatic agent to use. I think when we put that all together, we're going to have a comprehensive bleeding control plan that you can confidently walk into residency or any hospital with. This course was originally supposed to be a fun lab-based course with fake bleeding and fake arteries and fake injuries and all of that. In order to do kind of the same thing, I'm going to need you to play along. You're going to need to get a few things together if we're going to practice this. For bandaging, we're going to need gauze or something similar. Napkins, tissues, get creative. Acrylics, anything similar, roll-like. Ace wrap. If you've got Coban, it'll work. I think Ace Wrap's going to work a little better. Cheap cloth, a torn up t-shirt, something you don't mind wrapping up and getting kind of messed up, tying knots in, that sort of thing. For your tourniquet, you're going to need to get some tourniquet making material. If you've got a bandana, that would work perfectly. If you happen to have a triangular bandage, doesn't have fake blood on it, triangular bandage works awesome as tourniquet material. If you don't have that, old ratty undershirt or tank top or something that you could cut into a longish strip kind of thing and sort of get the job done. Need one other thing for the tourniquet. Any object resembling these items. Sharpie would work well, dry erase marker, reflex hammer, something that you can put in the tourniquet and turn without it breaking. So, assignment number 1, pre-test. Using the bandaging material, I want you to pick your least favorite limb, put a dressing and a bandage on, take a picture. For your tourniquet, apply a tourniquet. Make a tourniquet. In fact, you don't even have to use those materials if you think you have something better. As long as it's not a commercial tourniquet, make a tourniquet, take a picture of the end result, take those 2 pictures, send them in, you'll be good to go. That's it. Don't skip ahead, don't Google it, it's not for brownie points, and don't pretend you can't take pictures or your phone is broken. I know all of you guys are looking at coronavirus memes right now.